to me.
Information, news, and entertainment on demand.
WSRadio.com.
Accomplishment Coaching is proud to present the following fine programming. Accomplishment Coaching, where coaches lead and leaders coach. AccomplishmentCoaching.com.
Welcome to Leadership Insights Radio.
Thanks for listening in. I'm Wade Taylor, and on today's show, we're talking with Dr. Robert Singer, MD. He's a board-certified plastic surgeon here in La Jolla, California, and I encourage you to learn more about him online at rsingermd.com. And we're doing this episode on Leadership Insights Radio because first off, he is a great leader here in San Diego. He's been involved with medicine since the 70s. He's seen many things come, seen many things go. He's got a great perspective on everything. And being one of the core foundations of our success is our health. But sometimes there are things that we need to be cautious about our health. Appearance is critical to how we're perceived by society. A lot of women have gone in for breast implants because they're wanting to maintain the standards of beauty that they're seeing on the television, and they feel compelled to compete against, which can be a wonderful, life-affirming, self-confidence-building thing. But people sometimes have run into problems. And so, as I understand, you're wanting to share with us some of the cautionary tales involving breast augmentation that people should be aware of.
Happy to do that. And breast implants have become a hot topic with the FDA and worldwide because of some issues. But to put this in perspective, breast augmentation is the most frequently done cosmetic surgical procedure worldwide.
Wow, I did not know that.
And also nationally in the U.S. In all ages, the breast implants are used for breast augmentation, somebody who's never developed breasts, somebody who's lost volume with weight loss or with aging or after pregnancy. And it's also used for reconstruction for patients who unfortunately have developed breast cancer, to make them feel whole again. So it's not just used for augmentation.
Right. Well, yeah, it's not necessarily that, I guess, chasing celebrity look. One of the things that I'm sure you've got opinions on is how the celebrity culture is creating perhaps false ideals. But more often, it's about dealing with some issue that just a little bit of attention to can improve that person's outlook, improve their appearance, and just improve their self-confidence and that self-acceptance.
I think that's the essence of everything that we do. When I talk to patients, I explain to them that the greatest difference is not the physical difference, it's the emotional difference, how they perceive themselves and feel about themselves. So patients who come in need to come in with the right motivation. If they're doing this for someone else, they'll be disappointed. They need to understand what's realistic and what's not, that the images they see on social media, on reality TV, that's excessive. Most patients just want to look better and feel comfortable about something either that they've never had and feel in proportion, or that they've lost and want to feel that they've regained. The important thing is to make sure that you speak to a board-certified plastic surgeon by the American Board of Plastic Surgery, because there are a lot of people out there who claim to be cosmetic surgeons who don't necessarily have any formal training. Their background may be internal medicine or emergency room medicine, and they've taken a weekend course. They operate in facilities that are not accredited, facilities that have oversight, and they really don't go through all of the informed consent that's necessary to understand. Breast implants may not last forever. At one point, somebody at the FDA said, they'll have to be replaced at 10 years. Well, there's no valid information about that. I've had patients who've had implants since the late 70s. They're still intact. But a lot of the patients from that time have their implants changed for different reasons, not necessarily because there was a problem, but they want, as they've aged, they lose volume. They want to have a refinement in it. Patients who have breast reconstruction, often it's more than one stage.
Okay.
So they have to understand that. Nobody can guarantee the life cycle of the implant, and they have to understand it's a surgical procedure with potential problems. The vast majority of patients who have breast implants, the actual data is in the 90% are happy and would do it again.
Okay.
But there are some patients who may develop some problems. Like any surgery, they may develop an infection long term. That's rare. They may get some hardness, not of the implant, but the tissue around it, called capsular contraction. And there are a lot of things that we do today to diminish that. And there are refinements in the implants. The implants have improved greatly since the 70s. And before that, everything in the world was used to augment the breast. There were injections, paraffin injections.
Good grief.
There were rubber bands. There were ivory balls. There was, you name it, has been used. So that all changed with the development of the breast implant. Now, silicone injections in the breast are not approved, shouldn't be done. One of the things that also has been added as a refinement is using your own fat to augment the breast or to refine the breast augmentation after an implant. That's less predictable than an implant and has some of its own problems, but in the right patient may be a good adjunct. One of the concerns the FDA currently has is there is a subgroup of implants. Implants come in a couple of types. They can be filled with sterile water or sterile saline, salt water, or they can be filled with silicone gel. They're probably the most tested medical devices out there. The outer surface of all of them is a silicone, firm rubber type. And that's also used in heart valves, pacemakers, a lot of other things besides breast implants. The concern has been more with the outer shell. It can be either smooth or it can be rough surface called textured. The texturing was thought to decrease the chance of the body squeezing down on the implant and causing a distortion called capsular contraction.
Okay.
The problem with the texturing, it may be micro-texturing, small amounts of irregularities, or macro-texturing, so greater irregularities on the outer surface. The macro-textured has been involved with an increased number of patients who develop not technically a breast cancer, but a lymphoid tumor called ALCL, which occurs in the capsule and fluid around the implant. Some of those have gone on to cause more serious problems.
Okay.
But let's put it in perspective. There's 20 to 35 million patients with implants around the world. There have been somewhat, just less than 600 documented cases of ALCL. So small percentage, but a real
Something to be aware
and
of.
for the patient who has that, that's, it's 100% for them. So patients have to be aware of that. So there was, quote, a recall.
Okay.
Technically not a recall. The FDA said those manufacturers that have made the macro-textured implants should make the public aware, and the people who have those can electively have them, should have or may have them electively removed if they're having any problems.
Okay.
So the problems may be a ruptured implant, it may be the capsular contraction, or generally if there's a significant increase in the size of the breast with swelling that wasn't there before from fluid accumulation. So that fluid can be tested to see if there is ALCL. But recall generally means anybody who has these, come in, have them replaced. That's not what this means, because they say if you're not having any problem, you don't have to do that. So the best thing to do is go see if your surgeon, assuming it's a board-certified plastic surgeon. If it wasn't, go see a board-certified plastic surgeon. Be examined, and then see if there are any valid tests like an MRI or a high-resolution ultrasound that you should do or mammogram to detect if the implant is okay and if there's any problems. There are no specific lab tests that show that you may have a problem with the implants. There's a discussion about what's called BII, breast implant illness. And I put that in quotation marks because it's not a real validated disease. It may be in some patients, but these patients have a consortium of symptoms, everything from fatigue to brain fog to hypothyroidism to joint pain. But the vast majority of patients in the population as they get older have all these symptoms too. And we don't have valid data about how many of these people had these symptoms before they had implants. So if there's a question, go be evaluated, see if you're not having a problem, you don't necessarily have to have your implant removed or changed.
Okay. So a great PSA. I appreciate the time. Learn more at rsingermd.com. Back next time.
One person has the power to change the world, impact millions of lives, and leave a legacy for lifetimes to come. That person is you. In the New York Times bestseller, What is Your What? Steve Olsher, award-winning author and founder of the Reinvention Workshop, reveals his proven process that has helped thousands of men and women discover, share, and monetize the one thing they were born to do. Grab your free copy now at www.whatisyourwhat.com/free. That's www.whatisyourwhat.com/free.
Take a break from politics. Tune in and learn something. WS Radio shows are worth your time and are filled with tips and advice. Add us to your lunch routine and we'll give you a meal for your mind.
I raised $8,000 to build schools for South African children. After realizing how many people go hungry in San Diego, I now volunteer at a food pantry.
I'm spending the next year doing volunteer projects across 3 countries and helping in ways they designate to be the most helpful.
The World Link program at the Joan B. Kroc Institute for Peace and Justice recognizes the potential of youth as agents of social change. Learn how you can help youth become a generation of leaders in action at peace.sandiego.edu.
I've heard this is like one of the best pizza spots in town.
Yes, it is.
I'll do a slice of pepperoni, slice of vegetarian.
You got it.
And I will pay for all of that in 3 days.
In 3 days?
What's that mean? Well, wait, you accept credit cards. That money's not going to hit your account for 3 days anyway.
I need my money quicker.
At Chase, we hear you. With Express Funding, card payments are in your Chase account the next business day. Go to chase.com/expressfunding. Chase for business, so you can.
Compensated participation. All businesses are subject to credit approval. Not all clients are eligible for next business day funding, and additional terms, conditions, and restrictions apply.
Do you want to be a professional coach? Are you in business trying to make a real difference with people you manage or work with? Have you started a coaching practice that isn't quite getting off the ground? Get the skills you need to be a successful coach today with the Coaches Training Program from Accomplishment Coaching. The Coaches Training Program will show you how to help others focus and be more fulfilled. Whether you want to improve your company's bottom line or create a thriving coaching practice, Accomplishment Coaching can give you the distinctions and practices you need to coach others effectively today. Accomplishment Coaching has spent 6 years developing a cutting-edge coaches training program that will have you ready to coach people professionally in just 12 months, and you don't have to take time off work to do it. To find out more about the Coaches Training Program, just call 1-888-548-6813. That's 1-888-548-6813.